Hi, and welcome back to Girl Talk. We're having a lovely time in a lovely kitchen at Bella Domicile right off Nesbitt Road. We're going to jump right in. I want to introduce someone really special sitting next to me here. This is Julia Lombardo from Capital Physical Therapy. Thanks for joining us today.
Hi, great, thank you.
Capital Physical Therapy has been around for a bit of time and has many locations. Is that correct?
Yes, we have 6 locations across Dane County, and we've been in business for 13 years now.
That's fantastic.
That's fabulous. Congratulations.
Thank you.
That's awesome.
Absolutely.
So being a physical therapist, tell us a little bit about what you do and how it all works.
Yeah, sure. So physical therapists, we are movement specialists. Okay. So if something in your body isn't moving correctly, like you have back pain or you have had a knee surgery or some problem with your ankle, that sort of thing, if you're not moving correctly, we're the team to bring in. So a lot of times people think of those conditions when they think of a physical therapist, shoulder pain, neck pain, back pain, that sort of thing. But we also treat things that are maybe a little less commonly known, like we treat women through breast cancer, and we treat pelvic floor problems and pain during pregnancy and vertigo and jaw pain, that sort of thing.
Oh,
interesting. Well, now you mentioned breast cancer patients, which I didn't realize that physical therapy could help. And this is really fitting because it is Breast Cancer Awareness Month too. So it's great to have you talking about this, especially now.
Yes.
How does that work? Tell us more about that.
Yeah, so this is very near and dear to me. I'm really passionate about it because I'm a breast cancer survivor and I've been a therapist for 20 years. And what I found during my care when I was going through breast cancer was that not one person or provider had ever asked me if I could move my arms or my chest or if I had returned back to doing anything that I love to do. Like, for me particularly, it was gym workouts and water skiing. And so I went back to my team and I said, you know what? We need to be the team that can solve this in this marketplace. So I trained my team, and we're really honored to treat a lot of breast cancer patients in this area.
Oh, good for you. Thank you for the hard work on that. And it came right from your experience.
Yeah.
And by the way, I just love that you're a water skier. That's fabulous.
Super fun. Love it.
Absolutely. So why do you think, I'm glad that you've gotten ahead of the game now and trained your team in order to prevent the problem that you had, which was no one offered this to you. Why do you think that was?
It's an awareness issue. It's an awareness issue that we've known for a number of years. Back in 2002, they did a study that they followed 300 breast cancer patients over 6 years, and they found that 60% of these women had at least one symptom that was amenable to physical therapy, and yet only 20% were being referred. Wow. So then, a decade later, in 2012, the journal Cancer came out with what's called the prospective surveillance model and the gold standard of care for breast cancer, and it lists a physical therapist on the team. And so I've been really passionate about educating the public and the medical providers in this area that that's the gold standard of care that's supported by both the American Cancer Society and the American Physical Therapy Association.
Wow. That is just so fantastic. And as far as physical therapy goes for breast cancer survivors, what does that look like? How does it work?
Well, that's a really interesting question too, because it really depends on the course or the timing of their care. So they might be in the middle of chemotherapy, which would be different than what we would do with them during radiation, or if they're just post-surgical. So our team in particular, we know the surgeries very well. There are lots of different surgical approaches, and sometimes it can be, just surgery of the chest, and sometimes there's surgery also that involves the abdomen, and some of those surgeries even involve the back, which, they use some of the back tissue to create a breast. And our team knows very well the tissues that are involved in those surgeries and how to rehab those. And a lot of it is hands-on care and progressive strengthening and things like that. During chemotherapy, it's it can be very different. Chemotherapy and radiation leads to a lot of cancer-related fatigue, and we know exercise is the non-drug treatment that can help combat those normal symptoms that you think about with chemotherapy and radiation.
So there's so much to learn.
Yeah.
So thank you.
A lot of really important stuff here. What would you like to leave with our viewers? What are your thoughts that you want to make sure that you're getting across to people?
Yeah, advocate for yourself. If women, do your breast exams and make sure that you're getting your mammograms and get these things that are the cancers that are detected early save lives, and it's really important. And advocate for yourself. If you want to have therapy and have some guidance, be asking for it, because the awareness isn't out there, generally on its own. So, be your own advocate.
Julie, thank you so much for being here today
you're
and sharing
welcome.
all of this information. So much more to learn out there. Always you can get in touch with Julie, Capital Physical Therapy. Thank you again for joining us. So much to learn. Any way to get more information out there, especially during October, fantastic. Again, Julie, thank you for joining us. Thanks for being here. It was lovely having you.
Thank you.
Stick around. Stay tuned for more Girl Talk here at Bella Domicile.